Good morning, everyone. My name is Amanda Hinks. I'm the Maternity Service Development Manager for Counties Manukau DHB, a role that was born out of our maternity review over 2011-2012 when counties had an internal review of its maternity services, trying to identify really how we can improve our perinatal mortality rate, which is often seen as an outlier in comparison with the rest of the country. What I'm going to be speaking with you about this morning is around ultrasound scans, and this was a work stream that fell out of the review, again in relation to trying to improve our perinatal mortality rate. And so what I've been involved in over the past 2 years in this role is looking at our access to ultrasound scans and trying to improve that journey for our women during their pregnancy. There are also some sort of practice points, I suppose, which on speaking with Sue, who kindly invited me to speak today, for you as on the ground doing the clinical interaction with the women for you to take away. And that's spawned from information that has been shared with me as I've gone through looking at our ultrasound scan services. So let's just kick off with a bit of background. So this is about Counties Manukau DHB. I understand this is a regional meeting, but obviously we'd like to share what we've been doing. So the challenges that we've been facing really since 2015 within our ultrasound scans and access to scans in primary care. I'm not talking about scans in secondary care. I'm talking about scans for nuchal translucency, anatomies and growth, which in counties are all done by primary care providers. Private providers, so who are funded by the Ministry of Health through Section 88. And what we noticed at the end of 2015, I was notified by one of our providers that traditionally in South Auckland, historically I should say, pregnant women have not had to pay co-payments for their ultrasound scans, something that I think has been in place probably in the wider Metro Auckland area, but for South Auckland women there was no fee to pay. And there was an introduction of fees. It started with a nominal fee, $10 for an anatomy scan. I think now it's around $30, $40 co-payment for an anatomy scan, $10 at some of our providers for growth scans. I won't dwell on that because I'll come back to that point. Another aspect around improving that journey for our pregnant women with a view to monitoring their pregnancies was around access to urgent pregnancy scan investigations. Our maternity review identified that there was waiting times often for women who, perhaps, shouldn't have been waiting maybe, 4 or 5 days for access to a growth scan or an assessment of their pregnancy. Again, I'll come back to that point as I identify what we've actually been doing in that space. Unable to access scan results on Test Safe, that seems to be something that I hear is not only a regional problem but a national issue as well, and I know that issue is being spoken about regionally at an ultrasound forum with no landing as yet, but again that's a recommendation in one of the practice points that I go on to talk about later in the presentation. And inappropriate timing of dating scans, which I think is something that Namisha and Sue touched on. We don't want our pregnant women to be having high numbers of ultrasound scans. It's not only we don't know, the effect of these scans on the pregnancy, but also it's a huge drain on our very tight health dollar as well. So going back to the point about the funded co-pays, we in counties recognise that a very high proportion, probably over 4,000 of our pregnant women are in what we would call living in sort of decile 9 and 10 financial hardship, and finding the $40 co-payment that was required for an anatomy scan, which is a scan in my opinion that should be actually free of charge. We found out anecdotally that women were not going for their anatomy scans, and when the midwife was following up with them, they were sharing the fact that finding the $40 co-payment was a choice between having food on the table and going for the scan. Was obviously feeding their family was going to come first. So we put in a system which is running today. It's running across all our 5 providers of ultrasound scans in Counties Manukau, where in consultation with the midwife who's requesting the anatomy scan or the growth scan, which it could be you as GPs as well. It's open to GPs in counties with women who are residing in counties area who need an anatomy scan and who are unable to pay the co-payment because of financial difficulties. We have a system in place where you can where the DHB actually funds the co-payment for the women, and that's administrated through the District Health Board at Lambie Drive. Which has been very successful, and at the moment we just fund the copay for anatomies and growth scans. Another system that we set up as a result of the review was looking at access to urgent ultrasound scans for women in Counties Manukau. And so we organised with POAC a system where GPs and LMC midwives can refer women in who are fitting one of the criteria below. So women that you've got a suspicion of carrying an ectopic pregnancy, I must say that is a low suspicion of carrying an ectopic pregnancy. So if you obviously clinically suspect it is an ectopic pregnancy, then obviously you follow that referral pathway into secondary care. But if you think there's a low suspicion there, then this woman can be seen urgently through contacting POAC for usually, which would be a same-day scan. Again, the other criteria that we put under access to urgent scans through POAC is a growth scan. That can include Dopplers, Lycra volumes, anything where you think that fetus is at risk of dropping off its perch, basically, and needs an urgent scan. Malpresentation after 36 weeks. That again facilitates a quick turnaround for women who are wanting to have an ECV, an external cephalic version. Post-dates growth and Lycra volume assessment. Pregnancy anatomy scans after 28 weeks, although POAC are happy to facilitate these after 24 weeks. And that's because in counties we have a high number of women who book late for pregnancy care, and we didn't want to you as GPs or LMCs to ring the scan providers and they say, oh, you've got a 2-week wait for an anatomy scan. So they go through Zika virus when that came about, if you need an urgent again, and yeah, I've got low suspicion there again of ectopic pregnancy. I've been told to hurry up, so I will. Just wanted to share with you best practice around the ultrasound scanning in the first trimester, and thank you to Renuka for this information, who's going to be speaking to you soon. The most reliable time for a dating scan is around 7 to 8 weeks. You can read that there. And again, for multiple pregnancies, you can see that the importance of that is around diagnosing the chorionicity and amnionicity of those fetuses. And then the nuchal translucency, it's actually recommended around the scan around 12 weeks, but as you know, can be done earlier or slightly later. Okay, basically you can read this slide, but if you want further information, particularly around the co-payments or the POAC system, please contact myself. My email's at the bottom there, or go through Sue Tutty, who's the GP liaison. And we're more than happy to share with you if you're in a DHB where you might like to sort of look at developing these types of services. More than happy to talk to you about how it's been for us. Okay, thank you very much.